University of North Carolina political science professor Virginia Gray is the co-author of this book, Interest Groups and Healthcare Reform Across the United States. Professor Gray, how did you get involved in the healthcare world?
Well, I was a member of the board of directors of a large HMO in Minneapolis, and eventually I became chair of the board. It has a consumer board. It's a nonprofit HMO. And that led me to be interested. And then most of my work is on public policy and state politics. So it's definitely a hot topic at the state level as well as at the national level. So it was a pretty natural fit.
Well, one of the things you write in your book is that the rise and fall of managed care is one of the most significant stories associated with the politics of healthcare during the last 50 years. What does that mean?
Well, it's very interesting because it started out, it was HMOs, health maintenance organizations, were something that was kind of an idea of liberals, and they were pushed by liberal advocates in the 1960s. And basically, people who belonged to them were people who embraced the concept, and the doctors who worked in those plans also embraced the concept. And then in 1974, President Nixon established HMOs as a federal concept and put some money into supporting those. But that kind of changed the politics, because then the idea was to help lower the cost of health care. And gradually, employer plans started to offer more and more HMOs, but with few options for their employees. So pretty soon, by the end of the 80s, you had a very large percentage of the employee population enrolled in HMOs, but they were kind of unwillingly there. And the doctors were also unwillingly there. And as I know from teaching required courses, when people are unwillingly there, they're usually unhappy. So the happiness with HMOs eroded as more and more people were forced into them. And then in the 1990s, there was a backlash against the kind of tightly controlled HMOs that we were familiar with from the beginning. And so I think it's this rise and fall that's so interesting. And just to add a postscript to what's happening now, with the passage of the Affordable Care Act, it establishes and encourages states to try accountable healthcare organizations, which sounds suspiciously like the old HMOs. So it's kind of like it keeps coming around again. So it'll be interesting to see how those work out, the ACOs.
On C-SPAN and on Book TV, we often talk about the federal efforts to reform healthcare. But what's been happening in the states over the years?
Well, that was what interested us, because, as you say, most of the attention has been on the national level. And there the story has basically been, why no national health insurance compared to other countries comparable to us? We're the only ones that don't have a national, or didn't have a national health care plan. But what interested us was that at the state level, states had tried a number of different efforts, beginning as far back as the mid-1970s, to do three things. First of all, to start pharmacy assistance programs for their seniors. Secondly, to regulate managed care, which the federal government never managed to do. And thirdly, to offer universal coverage plans to their citizens. And so it was interesting, because you would think that the states would be less able to do this than the national government, and there would be more control by the opponents, by the interest groups that oppose such efforts than you would have even at the national level. So the fact that, certainly not all states, but quite a few states managed to do this, made it interesting to us. So originally our book was entitled Against All Odds, and that's kind of the way I think of it. The fact that the states did anything at all was kind of against all odds.
What were some of the states that stood out to you?
Well, in terms of universal coverage, there were a set of 7 states that enacted reforms in the 1980s, and these were states like Massachusetts and Washington and Minnesota, and some of the others that have typically been reformers in the healthcare area. Now, not all of these ever got implemented because they ran into various problems, budgetary, change in party control, and so forth. And then in the 2000s, after our study ends, of course, you had the example of Maine and Vermont and Massachusetts all starting new plans. So there's kind of been a new effort in the 2000s before the Affordable Care Act. And those later plans have been more successful, although Maine has now repealed its plan because its new governor doesn't like that plan.
The beginning of the title of your book, Interest Groups.
Right.
What are some of the more influential interest groups on the state levels?
Well, on the advocacy side,
Advocacy for
universal coverage for these pharmaceutical assistance programs. We have just some reform efforts that are specifically for those specific programs, but we also have provider clinics and independent organizations who want to expand access, and so that were frequently important, we found, in pushing the expansion of universal coverage at the state level. And then on the opposing side, there are some business groups, and those are probably the most important, and also some kind of financial tax groups who just worry about the cost of these programs.
What about the American Medical Association, the American Hospital Association, PhRMA? Are these groups that are active on the state level as well?
Yes, they are active, and
they don't always agree.
Right. And at different times, they take different positions on these issues. But in terms of the pharmacy assistance programs, the interest groups weren't very active in their adoption of these programs. But the drug lobby was important in revising these programs. So once they're on the books, they think, oh, it's a new market expansion, so let's get behind that and make it more generous. And so we saw that in those programs. And then we saw the hospital groups get behind expanding universal coverage because, again, that fills more beds. And then in terms of managed care, it's kind of a different coalition because that's a regulation, not so much a cost, not so much of an expenditure.
Virginia Gray, what kind of money is being spent on the state level to lobby different aspects of healthcare? You've got some charts in here that show.
Yeah. Mostly we didn't focus on the money because there's kind of a data problem at the state level in that not all the states report that. So there's only 42 states that do and 8 states that don't. So we didn't focus on that a lot. We focused more on how many interests were registered to lobby and kind of the proportion they constituted of all the groups. And then sometimes we compared that to the national level as well.
And what'd you find?
But certainly a lot of money is being spent. Well, for example, back in